step in. Step in, please. Thank you very much. How are you? Very good. Yeah, I was expecting you. I have your form right here, and I see that you have an eye examination. Is that correct? Okay, perfect. Very well, very well. Is there a particular reason for your eye examination today? Any any complaints? Okay, gotcha. So you seem to be having a bit of a visual problem seeing in this area, is that correct? Okay. And how long has that been going on for? Got it. Do you know what the cause of that might be? Like where it came from, anything like that? Okay. Gotcha, gotcha. It's okay. Don't worry, we're gonna get you settled in. We're gonna get you settled. Don't you worry. Okay. And what about this side? Any issues at all? Okay. So I'm gonna go ahead and run you through a couple of tests, couple examinations, okay? And see how I can help you out, okay? All right. So let me just get some gloves on first. There we are. I hate these things sometimes. They get a little. It's a little hard to open them up, you know. So, are you having any trouble, I suppose, with light or anything like that? Okay, and what about colors? See everything alright? Alright. I see. Alright, well, no worries. No worries. About to do a couple examinations, see how we're gonna go ahead and take care of this particular issue. It might not be anything, it might be a little something, but just to let you know, I don't think it's gonna be anything too great. I mean, anything too major. So, you can go ahead and breathe a sigh of relief, okay? Okay, excellent. So, before we do begin, I'm gonna go ahead and just take your temperature, alright? So, you can go ahead and sit down. Perfect. And, yeah, I'm sure you've heard this before. Go ahead and, square up with me. Very good. No. Put your hands down. Good. There we go. Alright. Very good. And I'm gonna do it one more time, just to be sure. Perfect. Okay. Right, let's go ahead and just write that down. Very good. Okay. So, let me go ahead and just take a look into your eyes, okay? I'm gonna look at both of them, alright, individually. Alright, so if you allow me, I'm just gonna put my hand on you. Yeah, just like this, okay? Alright. Can you actually close your eye for me, please? Good. Alright. Alright. Very good. Very good. Beautiful. Okay. So let me also go ahead and take a look at this side as well. if you can go ahead and close your eyes. Very good, very good. Nice. Okay. Go ahead and open your eyes. Can you just do me a favor? Go ahead and look at me right here. My nose. Good. And can you look this way for me? Good. And now look that way. And up. Good job. I'm gonna put my hand on your face right here. I'm just gonna pull down a little bit, and I'm gonna ask you to go ahead and look down. All right, and on this side as well. Okay. All right. Good. And you said how long has this been happening to you for? Oh, okay. So I'm actually okay. Okay, here we go. All right. So I'm just gonna ask that you I just ask that you look directly into the light for me. Yeah, I'm gonna actually need to really take a good deep look into your eye, okay? See what's happening, see why this is an issue, okay? So, if you will, please go ahead and just look, not my eye, but into the eye of the tool. Thank you. Very good. Very good. Alright, I see. Alright, thank you. And this is the problematic side, correct? Okay, so I'm gonna take a look a little bit more extensively on this side. So I will need you to go ahead and just look into the eye for me. Good. Yeah, just look at the light for me. Okay. And if you could please look straight up. Yep, just look up. Good. Very good. Good job, good job. So, you mentioned that you have it just a little bit on this side, but the major problem is on this side, correct? Okay, so here's what I'm going to do. You see this light? I just want you to follow it. Okay. Yep. Yeah, just look into the eye of the tool. Just like that. Good. Beautiful. Beautiful. Okay. Good. Alright. Excellent. And how did that make you feel? Did that give you, did it bother you at all? Or at least a little bit more than the norm? You're not sure? Okay. Let's go ahead and do a couple of tests with the light, okay? So, what I'm gonna do is, I'm just gonna shine this light. And right now, all I want you to do is look right here at my nose. Good. And I'm just gonna go ahead and move the light. I'm gonna move the light across your field of view. And all I need you to do is, I need you to let me know the moment that the light becomes fuzzy or blurry to you, alright? Okay, so here we are. Okay. Gotcha. And right now, can you see the light? Okay. We're going to do it the other way now. Alright. And can you see the light? Okay. Just I'll go ahead and just put my hand just above, like where your eyebrow is, basically, and I'm just gonna go ahead and just lift it up a little bit. All right. Just let in a little bit more light so that you're not kind of trying to squint your eyes a little bit. Let a little bit more light in, and if it causes any discomfort, please let me know. I'm looking for if you receive any kind of sharp pain. Okay, if you receive that, let me know. Okay. Yeah. Good. Good. All right. Anything? Okay. Go ahead and do it on this side as well. Good. And how's that? All right. So, much like before, how I had you just look at me and I was moving the light around. Okay, I actually want you to follow the light this time. Okay. Okay. Good. Just follow the light for me. Good. I see your eyes are wandering just a little bit as I get over here. Okay. Alright. Good. Let's get over to this side. Good job. Good. Alright. So, why don't you go ahead and cover this eye for me. Yeah, just like that. Good. Yeah, here. Just like this. Good. And I'm going to begin moving the light in, and I just want you to watch the light, okay? So just follow it. Okay. Let's go ahead and do it on this side as well. Very well, very well. And how is that? A little tiring. Okay. Very good. I'm going to go ahead and just do a little bit of stretching right here. Okay. I want to stretch out your just stretch your eye out just a little bit. Well, not your eye, but just the skin around it. Okay. Right. Very good. All right. And any pain with that? Anything at all? No. Okay. Alright, so I'm going to go ahead and just move my fingers across, okay? And I just need you to go ahead and follow them, alright? Yeah, just please follow my fingers, okay? So we're going to go ahead and begin with both eyes at the same time, okay? Good job, so go ahead and, good. doesn't seem like there's too much of an issue with that. How about if I need to see if there's a problem with maybe with distance, with this blurriness that you may be having. What if I do this? So I'm gonna barely move my fingers. I'm gonna basically go like this. And I just want you to really focus and see if you can see that difference in the section where you cannot see very well, okay? Alright, so we're gonna just begin right about here. Okay, and good. Good. Alright. Very good. I'm going to begin moving it a little more. Alright. Good job. And I'm going to fully move it now. Good. Good. What if I actually bring my finger right about here and I move them? Can you see this? Alright, and what about on this side? Alright, and a little closer. Good, okay. Okay. So, I do have here a few color pencils, and I just would like you to let me know if you can see them even as they cross into the blurred part of your vision. All right. Okay. So what I'm going to do is I'm just going to move it across just like this. Okay. So here we are. Good. And we're going to begin moving. Good. You can look at it. Yes. Good. Good. Okay, so right here I should be in what I believe to be your blurry area. Can you still see it? Okay. And does it still look like a colored pencil to you? Alright. So I'm going to go ahead and utilize this one now. Ready? Good. Alright, and I'm going to stop right here. Can you still see it? And does it still look like colored pencil to you? Good. Let's go ahead and move to the other side. And we're going to stop. And once again, does it still look like a colored pencil to you? Okay. I'm going to go ahead and actually, I'm going to go ahead and just show you this. What does this look like to you? Even if you don't know what it is, what is the shape of the object? Okay. And what about its size? I think it's large, small, of medium. All right. Okay. And now we have two more pencils to show you. Here's another one. All right. I'm gonna go ahead and move it. Good. You can still see that. Good. And we're gonna move it across. And stop. And here. How is that? Okay. Very good. Very good. use this one now. Alright. And we're going to move it across. Good. Still good here. Alright. And we're going to move it across. Good job. Okay, so what I'm going to ask that you do, is you're just going to change your focus from one to the other. We're going to start off with the blue, and we're going to also utilize the light. Alright? Okay, so right here we have the blue and we have the light. All I want you to do is bounce back and forth between each other. We're going to keep them in that point where you're a little fuzzy, a little blurry, okay? And hopefully we can see if anything improves with this, okay? Alright, so go ahead and look at the blue. Good. Yeah. And the light. Good. That's it. The blue. And the light. The blue. And the light. Good. Very good job. Okay, so I'm gonna go ahead and perform this one last thing before I go ahead and give you some eye drops, because I think I've got it figured out, but just want to make sure. Okay, so actually I do have one more other thing, so we have two more things to do. Okay, so what I will ask you that you do right now is I'm going to show you some fingers. I'm going to show you some numbers with my fingers, and I just a little silly, yeah, but I just want you to tell me what number you see. Okay, so we're gonna keep it in the blur, okay, just to see how much you can actually see. All right, so please let me know when you see what number you see. You can call them out loud. Okay. Good. 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 All right. All right. All right. Okay. And we're going to bring it just a little closer. Okay. Good. Good job. Good job. So, I did say that I did have one more exam for you. And you ready for this? Okay. Go ahead and yeah. It's a two-part. It's a two-part to this last examination, but it will be interesting to see how you perform. Okay, so let's go ahead and grab this, and we're gonna use a Snellen chart. Okay, a mini one. So I'm going to ask that you let me know with both eyes open, obviously. Good. What is this letter? Good. And this one. Good job. Good. Good. And how about that one? Good job. Okay. Excuse me. So, for the last part, well, here's where the tricky part comes. I would like you to go ahead and close this eye. Good. And we're going to put this over here. Good. And now I want you to read this letter. Okay. And this one. Okay. And this one. Alright. And this one. And what about that one? Alright. So let's go ahead and switch sides. Let's go ahead and put that right about there, which I think it might be the area giving you some trouble. And you're going to go ahead and let me know what that one is. Okay. And that one. Alright. And this one. Good. And what about that one? Okay. And this one. And last one. Good job. How do you think that you did? Okay, well, here comes the second part to that. We do have a bigger size. So, let's see how you do with this one. So, here we're going to have you, yeah, same thing. I want you to cover one eye. Good. So, please read this letter. Alright. And this one. And this one. And that one. And here. Good. And here. And here. Okay. And what about that one? Okay. Let's go ahead and work on the other side now. Alright, so here we are. Okay. And this one. And that one. How about that one? Alright. And here. And there. And there. Okay, good. Okay, so yeah, I do have everything that I need for the examination. Okay, so it just looks like you just have some blurred vision. Obviously something that you already knew. Nothing, nothing too, it's nothing too crazy. It happens. Could be stressed. You could be feeling very anxious, stressed, like I already mentioned, and maybe a lack of sleep as well might be the problem. Even if maybe you fell asleep on the side. Yeah, if you maybe fell asleep on your side, maybe you had your hand there or something. Maybe you slept in an uncomfortable position where your eye was being pressed and you just happened to do it on both sides. That's why it's a little bit more severe on this side. Okay. So, just a possibility of something to kind of think about when you do sleep. I was going to give you some drops, but honestly, I think that you just need a little bit of rest. Okay. obviously going outside because obviously your peripherals are not, they're not very good at the moment. So you might want to be very careful when you're crossing the street or anything like that. Okay. Very good. Perfect. Okay. So, it was a pleasure having you here. I am Dr. Chris, and I would like to have a good day, please. Again, take care of yourself.